The Federation of Unions of South Africa, FEDUSA, has called on the Presidency to consider gazetting a special consideration that will allow the Department of Health and other key ministries to fill up all vacant public services posts as a matter of urgency. Now, that's in order to substantially increase the size of personnel available for the national effort to combat the explosion of the COVID-19 pandemic. But to tell us more, I'm joined via Skype by the FEDUSA General Secretary, Riefdah Ajam. Riefdah, very good evening to you. Thanks for joining us. Welcome.
A very good evening to you and good evening to your listeners.
Now, do expand for us, if you can, the implications of FEDUSA's call for the government to increase personnel of the health workers.
Well, as we can well understand, we've seen an absolutely exponential increase in the number of cases of positively confirmed people having contracted or being exposed to COVID-19. And for that reason, FEDUSA is making the call for government, in particularly within the health department, to fill up all those unfilled posts that have been laying vacant and dormant for many years. That would be the basis of the call that we are making now to ensure that there is not an overwhelming response and that the capacity that we have will not be able to handle the load.
Inasmuch as the capacity obviously needs to be augmented in light of the COVID-19 pandemic, which seems to be getting out of hand, should the government rather not add more personal protective equipment to the nurses rather?
You know, the situation is one that needs to be dealt with the necessary vigor. We currently see, based on the 2019 statistics, that there's approximately 120,000 vacancies within government. I'm going to cite two examples, even though everybody's making the calls for protective measures to be put in place, even though these have been widely propagated, we are still seeing the number of cases coming in on a daily basis. One of them in particular in Limpopo, where one of the 24-hour clinics that have been dealing with these cases are simply running without running water for the last week already. In the Eastern Cape, as you mentioned, you have EMRS personnel that are simply not being provided with the necessary equipment. And for this reason, we are saying it is not only just protective equipment that we are needing, but we need capacity to be able to deal with the matter. So it's two ways that you have to deal with this matter over and above the measures that have already been put in place.
So are you calling for the extra personnel to be roped in on a permanent basis while the country still deals with coronavirus, or do you want them to be roped in on a permanent basis?
Well, either way you look at it, government is going to have to show its hand in the matter. As we sit off today, we have 1,187 cases, a massive tenfold increase since the number of cases have been confirmed, by way of the minister as such. And what we are saying is we need urgent and extraordinary measures to deal with the situation. We cannot have a continued exponential increase of the matter when we need to be able to put measures in place to decisively deal with it. We have the capacity, and at this point in time we are saying augment to ensure that there's no overwhelming situation with already overstretched personnel.
Do you not anticipate resistance from government with regards to your call to add extra health workers? Since the government has already indicated that it plans on cutting down the public service as a result of austerity, so do you not think that the government will reject your calls?
This is simply not a time for anybody to be playing Russian roulette with the lives of South Africans, in particular the members of FEDUSA that stand in the front line of these very institutions that are supposed to be protecting the lives of our citizens. So when we take a look at health in particular, because when you look at the 120,000 posts that remain unfilled at this stage, it's not only just in health, it's education, the social services department per se, But our call comes specifically in wake of the health department that require assistance. The green light has already been given in terms of the ranch, and now we are saying the very areas that remain exposed, the very areas where we have seen the increases in the virus, such as Gauteng and Western Cape, they need to receive the necessary capacity in order to be able to deliver the service so that we can give the assurance to the rest of the South African population that we are ready and that we are capable to deal with the matter.
So have you been in touch with government with regards to this call?
The call has most certainly been put out already by way of our public service unions, and we have written to the various ministries. And as I say, what more can we do at this point in time? We've already appealed to the MEC, where we've had the situations not only in Limpopo but in the Eastern Cape, and we are now waiting for government to put its shoulder to the wheel to demonstrate to the rest of South Africa, as the President has so rightfully done, to make sure that we are able to respond to the call where the necessity lies.
Now, on Friday, Moodys downgraded South Africa's credit rating to sub-investment grade or junk status. And obviously, this couldn't have come at a worse time for South Africa, as it's still struggling to deal with the outbreak of coronavirus. So what's your analysis of such an outlook?
You know, it's an absolute blow to South Africa and to society at large. Although the writing was on the wall, the timing could not have been more terrible. We are all dealing with the grip of the coronavirus, not only in South Africa, but globally. And we were hoping that at least some reprieve could have been given to us, possibly after the 21-day lockdown. But as a collective, the social partners have been working on the matters to deal with not only the structural reforms, but various initiatives that could have been put in place. And once again, as we move forward, we need to ensure that greater determination is now in place for government in particular to demonstrate their ability to deal with the very issues that have been put in place, such as corruption, such as maladministration and wasteful expenditure. So for now, it's going to take a lot of collective wisdom in order to take us forward. But only time will tell in terms of where exactly it is that South Africa will be able to move towards.
All right, Riefdah, Ajam, thank you so much for your time. We appreciate it.